Well, it's my pleasure to introduce our panel on seniors, hospital, and the healthcare crisis. We have Nancy Altman, president of Social Security Works. She's been an active, progressive voice forever. We have Wendell Potter, an author and president of the Center for Health and Democracy. And also, you should know that we went to college together at the University of Tennessee in Knoxville, and we both worked on our first campaign together to get somebody elected to head the student council.
That's right. Yeah, how about that?
That was a long time ago. And our senator, U.S. Bernie Sanders. U.S. Senator.
So who's moderating this thing?
I don't know. How are we going to get this going?
All right, let me start it off, and I'm delighted to be here with Nancy and Wendell, two heroes of mine who have spent their lives fighting to protect seniors and bring justice to our broken healthcare system. Because this is the Sanders Institute, and my last name is Sanders, I'm going to take a little bit of leeway before we get into the issue, and that is, it goes without saying that our healthcare system is broken. I think everybody in America knows that. We spend twice as much per capita on healthcare as the people of any other country, yet we have tens of millions of people who are uninsured, underinsured. Our life expectancy is significantly lower than many other countries, and the life expectancy between wealthy people and working class people is outrageously high. We heard that the other day from Gigi talking about Washington, D.C. You live in a rich community, you live 10, 15 years longer than in a poorer community. So kind of everybody knows that the healthcare system is broken, that we're the only major country on earth that doesn't guarantee healthcare to all people as a human right. I think the point that I want to make is it is not just the healthcare system that is broken. The entire economic system is broken, but in a sense, it's not really broken. The system is doing what it is supposed to do. It is working very well for the people on top. In fact, it has never worked better. You know, we all listened to Stephanie the other day, and she talked about somebody's deficit is somebody else's surplus. That's precisely what's going on in the economy. So right now, for the top 1%, the economy is doing better, I suspect, than at any time in American history. Wealthiest people are exploding with wealth. If you're rich, we talk about a housing crisis. You know, these guys have not 1 home, 2 homes, 5 homes, 10 homes. You talk about healthcare, they get the best healthcare in the world. Their education, their kids go to very, very good schools, the wonderful childcare for their little ones. They don't have to wait on long lines for a bus or for a plane. They have their own jet planes. And it's not only the incredible wealth and the disparity of wealth that exists in America, the wealth of the people on top. With that wealth, obviously goes political power. So we hear a lot of talk about Congress, but I don't have to tell anybody that the political system in America is totally corrupt, in the sense not that people take bribes and break the law. They don't have to take bribes and break the law because people on top make the law. So if you make the laws, you don't have to break the laws. If you talk about laws that give huge tax breaks to the rich and large corporations that allow oil companies to destroy the planet, nothing to break. Oil companies aren't breaking the law. They're doing what's legal. They make the laws. So I think our overall goal, and when we talk about seniors, and Nancy and Wendell know a lot more than I do about it, it's the same old story. Yeah, we got, in the richest country in the history of the world, 25% of our seniors are trying to get by on $15,000 a year. Try it sometime. Half of our seniors are trying to get by on $30,000 a year. When I talk about anxiety and stress, half of older workers between 55 and 65 have virtually no retirement savings at all. And then you hear people talking about cutting Social Security. In terms of education, we used to be the best educated country on earth. We're now falling behind many other countries in terms of the percentage of our kids who go to get a higher education, and many of those kids leave school deeply in debt. So we don't have to harp on the issue, but it's not just a healthcare system that is broken. It is not just the way we treat our seniors, which is abysmal. We have the highest rate of childhood poverty of almost any major country on earth. But when it comes to tax breaks for billionaires, not a problem. You'll all be happy to know, I'm being facetious here, that the military budget now is close to $1 trillion. And you know how many dissenting votes there are in Congress? Very few. It came out of the Armed Forces Committee with one dissenting vote, like 20-1 or something like that, and that's kind of the way it is. With the exceptions in the House, there are some people who are voting against that budget. So you got a set of priorities which are totally backward, totally inhumane. That's the bad news. Now, what's the good news? My wife always told me I harp on the bad news, so occasionally I'll talk about the good news. I'll give you some good news. We got a broken healthcare system, but we have something else. In my extended family, which includes some of my staff, we recently had a crisis, a healthcare crisis. Kid became terribly ill very quickly. In almost a miraculous way, doctors in Boston did what had to be done, a miracle. Kid is 100% wonderful right now. You're seeing people having drugs, prescription drugs. You're seeing people undergoing medical treatment who are alive and well today who would have been dead not so many years ago. We are seeing an explosion of technology now, which we all take for granted. When I was a kid, I read things, some of you don't know what they are, they're called newspapers. They're paper. So I would read 1 or 2 of them a day, maybe. Now you go to the computer, you look at 15 papers around the world. If they're in a language you don't know, you can't understand, they are able to translate those things. That's extraordinary. And we're looking now at another revolution in terms of AI, which can significantly increase worker output and worker productivity. So on one hand, what we are looking at, and I got to make this point over and over again, the system is working for the people on top. And the people on top are not nice people by and large. They come across as being very nice, as intelligent, but in fact they are extremely greedy. And they're willing to step on anybody and everybody who gets in their way. One of the things we're dealing with, I'm chairman of the Health Education Labor Committee, so we're dealing with a lot of stuff. But one of the things we're dealing with is the issue of prescription drugs internationally. And Wendell, I know, knows a lot about that. Bottom line is, drugs have been developed, with COVID and the vaccine and many other drugs, which can save lives, can ease suffering all over the world. And these guys have the product. They have the intellectual property. They are prepared to allow people around the world to die or children to suffer because they can't pay the outrageous price. In this country alone, 1 out of 4 people cannot afford the medicine their doctors prescribe. How many of them die? How many of them suffer? Meanwhile, last year, 10 of the top pharmaceutical companies made $110 billion in profit. Insurance companies, the same thing. They're doing very, very well. People are dying because they can't get to a doctor on time. So I put all of that into the broad context. There is good news out there. If we had responsible government and a vibrant democracy, where government was working for the needs of the people, we can create a decent standard of living for all people. That is not utopian. That, in fact, already exists in a number of countries around the world. We could wipe out poverty. You don't have to have 600,000 people sleeping out on the streets, while 3 people own more wealth than the bottom half of American society. But those are not only figuring out how we can do it, more importantly, it is a political crisis in which government increasingly represents the people on top and ignores the vast majority of the people. So with that, let me give it over to, who wants to go? Nancy, you want to go? Okay.
Yeah, let me pick up on some of those themes, because I think those are very important themes. But let me start by thanking Jane and Dave and Shanna and everyone who put this gathering together. And it really has been about breaking down the silos, because all of our issues are interconnected. I mean, we call this seniors, and of course, almost everyone is either a senior or hopes to be a senior someday. It really, it's uniting, and yet only in Washington do they talk about intergenerational warfare, as if somehow, I sort of joke that when I was in my 20s and 30s, I was told Social Security wasn't going to be there. We can't afford Medicare. It's all these greedy geezers, talking about my parents and grandparents, and you're a victim. All that happened was I got older, and now I'm the victim, and my children and grandchildren, I'm the victimizer, and my children and grandchildren are now the victims. It is one of my favorite Franklin Roosevelt quotes was, and he said it in actually defense in 1936, just the year after Social Security was enacted and the Republicans were running against it. He said, "It's an old strategy of tyrants to delude their victims into doing their battles, fighting their battles for them. And it's the billionaires who are the tyrants. And they're trying to get all of us to fight against each other rather than to join." As we all know in this room, and as I think that we outnumber them, we really represent the vast majority of people. And the only way they can win is to divide us. And the way that we win is some of us lead on some issues, some on other issues, but we support each other on all of these issues. So I define Social Security, and Medicare is part of Social Security, the way that Franklin Roosevelt and his advisors and the architects defined it, and that was basic economic security. They understood Social Security to be, you have to have an education, and you can't come out of, start your career and be burdened by debt. In fact, it's an old American tradition. Tom Paine, who wrote Agrarian Justice, called for an old age pension system paid for by an estate tax. And he also, so we were part of the way to what he wanted. He also wanted people, when they reached maturity, to be given a lump sum of money that they could go and they could start their careers. So what does it mean to be economically secure? You have to have an education. You have to have a living wage. You have to have wage insurance. In a society like ours where you're dependent on your wages, what is wage insurance? You need to be insured against the loss of wages in the case of unemployment. You have to have it in the case of old age, disability, death leaving dependents. If you become sick, short-term disability, parental leave, all of those are part of what you need for basic economic security. Now, it's interesting that Franklin Roosevelt came close to proposing guaranteed universal health care. They studied it very closely. They were just about to propose it as part of the Social Security Act. Like today, the medical establishment came down hard against it, and at the last minute, he decided, he was worried that it would bring the whole bill down, so he decided to remove that part. He kept talking about it even during World War II. He was trying, he wanted it to be part of this second Bill of Rights. He then went to, Truman tried it, and it they kept blocking it. So they came upon a strategy, which is, let's start with Medicare for seniors, and we'll expand that. They actually had to debate whether it should be seniors or children, because seniors were in the disproportionately high healthcare needs, and they could not get insurance. But children, it's much less expensive, and then you have a whole lifetime of care. So they debated it. They decided to start with seniors. In 1972, people with disabilities was added to Medicare coverage, and they talked about Medikids, but progress stopped. It was, government's the problem, all of that. And so what they did was they stymied any kind of expansion, and Senator Sanders is on the forefront fighting for Medicare for all, fighting for adding hearing, vision, dental, all of which are extremely important. And we should start, even if we don't get Medicare for all, lowering the age and having a Medikids program and meeting in the middle. That would be extremely popular and is something that can be done. But what the billionaire class, funded campaign, has been doing is not only stymieing any progress, but working, and Wendell, I think you'll talk a lot about this, privatizing, starting back with Reagan, they started to subtly and not so subtly privatize Medicare. George Bush tried to privatize Social Security, that failed, but they've been unbelievably successful in privatizing Medicare. So we are really going in the wrong direction. But again, the American people are with us. One of my absolute favorite polls was done by Pew. It was March of 2016. And what they did, it was, in the height of the primaries. So I think Martin O'Malley was no longer in the race, but it was still Bernie and Hillary Clinton on the Democratic side. And the Republican side had whittled down, so it was now just Kasich, Ted Cruz, and Donald Trump. And the poll asked voters who they supported, who they planned to vote for, and then a series of issues. And, all kinds of issues, foreign and domestic issues. And they all came out sort of the way you would expect, except they did not ask about Medicare, but it would have come out the same. When they asked about Social Security, all of the dots, overwhelmingly, like 80%, were all circled around Bernie Sanders' name. Even those who were supporting Ted Cruz, who was for privatizing Social Security, they all came out. So it is a wedge issue. I know this is C3, so this is information, but it is an issue. It's a bread and butter issue. It's especially important to rural communities, which tend to be older. It is one where where MAGA Republicans, as I say, agree with Bernie Sanders on that. And it is all we need is a few percentage in the right states. And then I think when we have a Congress where Senator Sanders is in the majority and chairman and remain so, and we retake the House and we have the White House, we're going to make, I believe there'll be real progress on all these issues.
All right, let me interrupt you there, if I may,
Yes.
and give it over to Wendell. Wendell, thank you for all
Thank you,
you do.
Senator. And Senator, I used to work for one of those newspapers that you mentioned. I was a newspaper, after I left the University of Tennessee, I had a career in journalism in Memphis and Nashville and then in Washington. By the way, just an aside, can you imagine, we're people of a certain age, but just imagine Jane and me on the University of Tennessee campus as 20-year-olds getting our first start in politics and activism. And I had hair back then, a lot of it, and a mustache. And unlike Bill Clinton, I think I did inhale a time or two. But I had I spent a lot longer. Had a longer career on the dark side, working for health insurance companies. It's a long story we won't get into, but I wound up running corporate communications for Humana and then Cigna. So I saw how these companies really operate. And prior to that, I'd worked for a fairly large hospital system in Knoxville, Tennessee. So I know how this industry has changed and how they make money, where it comes from, what they do with it. Last year, the insurance companies have consolidated incredibly over the past several years, especially since the Affordable Care Act was passed through what's referred to as vertical integration. Last year, you said $1 trillion military budget. Last year, $1.4 trillion flowed through the 7 largest for-profit health insurance companies. They suck up so much, not only in our premiums, but they've figured out how to suck up money out of the pharmacy supply chain, from the Medicare program. Over the past 10 years, 3 of those big companies, United Healthcare, the biggest, Aetna, and Humana, actually last year insured fewer people of working age and people who get their coverage through the individual market than they did 10 years before. 100% of their enrollment gain came from public programs, from Medicare Advantage and Medicaid. And 3 big companies, United, Cigna, where I used to work, and CVS, which owns Aetna, collectively control 80% of the pharmacy benefit management program. So they make money every which way, to the point that they also are buying increasingly components of the healthcare delivery system. Between 2002 and 2024, there were 2,000 hospital mergers in this country. Yale University recently did a research project looking at the most recent 1,000 and found that only the FTC only took any kind of enforcement action against 13 of those. So these mergers have been able to go through, and we are where we are because of the lack of any real oversight and scrutiny of these
Wendell,
deals.
can I jump in and ask you a question here?
Yeah.
Because I think not a lot of people get into the detail that you're familiar with. Theoretically, in a rational healthcare system, if I spend $1, I want that dollar to go to doctors and nurses and prescription drugs and hospital costs.
Yeah.
What is the function of an insurance company in that process?
It shouldn't be what it is now. When we were younger, most of us, if we had insurance, we got it through a nonprofit Blue Cross plan. Those companies have largely converted to for-profit status. They have become enormous middlemen, and they're not necessary. In fact, as part of my newsletter, I have a part called disintermediation to try to get rid of the middleman. What can we do to get rid of that middleman function? Because it is sucking so much out of our tax dollars, out of the Medicare Trust Fund, out of the pharmacy supply chain, as I mentioned. But it doesn't provide any value. I call this disintermediation, this thing I'm doing with my newsletter. And that comes from a leadership meeting with my CEO before I left Cigna. And someone asked him, what keeps you up at night? And he said, disintermediation. And that is the fear, he said, that employers in particular would begin to wake up and question the value proposition of big insurance companies as the middleman. But they, as middlemen, take more and more and more of the dollars that we spend on health care.
What percentage, do you have it in your head? What percentage, if we spend $1, what percentage of the middle guys get who don't provide any health care?
Just as one example, in the pharmacy supply chain, of every dollar that Medicare spends on prescription drugs, 41 cents of that dollar goes to insurance companies, to their PBMs. Another, I think 13% goes to wholesalers or distributors. So more than half go to these middlemen. And 30% goes to the manufacturers. I mean, so in other words, they have figured, and we saw that slide yesterday that Chris Deacon had, showing that they got from litigation, from discovery, that Cigna, where I used to work, was able to take a bill, a very large bill, but capture more than the provider charged. It's insane what this middleman has done, and I think employers are beginning to wake up.
So you got the middlemen in the
policymakers too.
pharmaceutical industry and the middlemen in the insurance industry.
Yep.
We are spending, maybe Deb Richter can correct me if I'm wrong, what do you say, twice as what Canada spends in terms of
Yes.
administration. So what we can all agree, I mean, running a healthcare system is not easy under the best of the circumstances. But if you spend the dollar, you want it to go to healthcare.
Yeah.
And where our dollars are going to insurance companies who are doing phenomenally well,
Yeah.
drug companies doing phenomenally well, PBMs doing phenomenally well. And that is why, we need, in my view, I think we all share this, a universal healthcare system, Medicare for all single payer system. And the reason Deb Richter made this point yesterday in her presentation, we can provide healthcare to every man, woman, and child without spending any more because we're putting the money into healthcare, not into hundreds and hundreds of billions of dollars in wasted administration. Nancy?
And in fact, I mean, there are some things government does better than the private sector. Some, of course, are just moral, they should be doing, but it's also more efficient. Social Security, healthcare is certainly one example. Medicare is more efficient than, even though it's covering people with disabilities, seniors, people with the highest healthcare costs, spends less on administration than private sector insurance. Social Security spends less than a penny of every dollar on administration, more than 99 cents goes out in benefits. In contrast, I think it's Liberty Mutual spends something like 18 or 20% on administrative costs. And the reasons are obvious. First of all, insurance is most efficient if you have the largest risk pool that you can have. The government is the only one that can mandate the entire risk pool, which is why universal health insurance, one system, makes the most sense. You're not paying high-paid CEOs, you're paying civil servants. You don't have to spend a lot of money advertising. We've all seen the advertisements on television. If it's a government provided system, it's just fairer, it's better, it's more efficient, and it also frees, and it affects everything else. It improves mobility because so many people feel trapped to their employers so they can keep their health insurance.
All right, and also, if you have, and Wendell, jump in here, if you have a for-profit system and I'm the insurance company, do I make much money keeping people healthy?
No.
No, you don't. In fact, there's an incentive against that, and they increasingly are reluctant to pay claims that they should be paying. And they're also very short-term focused. They know there's a lot of churn, as they call it, in health insurance. So they don't have an incentive to try to get people healthy or keep them well in the first place. And hospitals are largely the same way. So we have a system. It's another reason why we're living shorter lives than people in other countries. But this is also why despite that, we'll be spending $5 trillion on health care, almost 20% of GDP, as has been mentioned. About a third of that has been shown to be largely, well, it doesn't go toward keeping us healthy or even getting us well. It's eaten up by administrative expenses. Deb, one of her slides was comparing the University's Toronto hospital system with Duke University. Just a small number of people in Toronto are involved in administration, and over 1,000 at just that one hospital system. That's replicated all over the country. So you've got all of this money that's being going into these companies. Physicians and hospitals have to have these these folks on staff to deal with insurance companies, to try to get paid appropriately. But that is money that is also money that could be diverted to universal health care.
Let me ask Nancy, because Nancy hangs out a bit in Washington, D.C., right? So if we are spending twice as much per capita as other countries, if our healthcare outcomes are worse, how come? And in your judgment, what are the impediments for Congress to respond accordingly?
Well, I think it's the the politics, not the policy, because it's obvious that that system, in fact, I was going to mention, we were talking about the efficiency, there's a wonderful video that you did that if anyone hasn't seen it, they should, because it's not just the cost, it's also the stress when you're feeling sick and you should be focused on trying to get better, your family should be focused, and instead you're running through trying to figure out how to pay, how to get approval.
We did a meeting years ago in Iowa, which I'll never forget, in which we talked about medical debt. We have about 500,000 people every single year who go bankrupt because of medically related debt. So think about it for a second. Think about coming down with cancer or serious heart disease. All of the pressure, oh my God, you got to deal with your life. Am I going to live? Am I going to die? All of the pressure on you. And then on top of that, suddenly, you're worried that your family is going to go bankrupt. Yeah. And we had stories where people would not even tell their wives about what was going on for fear of the financial implications of that. But think about the cruelty of people not only having to worry about whether they're going to live or die, what it means to their families, but whether their families are going to go bankrupt. All right, but I wanted to get about what are the, without being partisan here, in many ways, sadly nonpartisan, what are the, you bump into lobbyists in Washington, D.C.? I mean, are we having a vigorous discussion? When you turn on TV tonight, you're going to have CBS saying, we spend twice as much as other countries, our outcomes are worse. Wendell, why is that?
Yeah,
Nancy?
Big pharma is part of the reason. In fact, when drugs were added to Medicare, as they should have been, they were done not just that it's a benefit, that it's part of your benefit. It was a private, it was like Medicare Advantage, a private insurance piece, and they forbade Medicare from even negotiating.
Specific language was put in by the chairman of a committee. And just coincidentally, do you happen to remember, Nancy, what happened to that guy who was chairman of the committee who put specific language in the bill that Medicare could not negotiate prices like every other country on earth? Gee, he went to work for a low-income group, I think. Was that it?
Yes.
Now, what happened to him?
Little revolving door.
And he became the head of pharma.
Yeah. That's right.
The CEO of pharma a few years later. Clearly a major coincidence, but that was a major decision. And in fact, it's taken us all these years to begin finally the process, too slowly, too little, but to begin negotiating drug prices through Medicare.
Yeah.
And I
Well, I was going to say that same bill, it was the Medicare Modernization Act of 2003, which is exactly as you described it. But it's also the bill that created the current Medicare Advantage program. Privatization was already underway, but this made it so much more lucrative for big insurance companies to get into that business, and it's been a huge cash cow for them. And
I'd say a word. I'm going to interrupt because I want you to explain. You're talking not only to the people in this room, but a few 100,000 people on the live stream.
Yeah.
All right. Why do people go into Medicare? What is Medicare not providing right now that attracts people to private Medicare Advantage?
Yeah. I think the main thing is that, well, first of all, they're bombarded with deceptive advertising. They think that Medicare Advantage is a no-brainer. The advertising is purposely meant to obscure important information, and I know that from all the time that I spent in the industry, how expert they are at leaving important stuff out, how they can confuse people. But the traditional program needs to be fixed. It needs to be improved. We've talked about Medicare for All, but then we started talking about improving and expanding Medicare.
That was part of the strategy, that you don't allow traditional Medicare to expand, so people have to get Medigap, this private insurance,
which
to
is
fill
expensive.
in the gaps.
Which provides what?
Well, it provides an out-of-pocket cap and other kinds of services.
It provides dental,
and
hearing,
vision.
And vision.
Yeah.
So in other words, what we have tried to do in the last few years is do two things. Expand Medicare, traditional Medicare, to cover dental, which is a huge, we're talking, we had a hearing on this the other day, a unbelievable percentage of elderly people have no teeth, no real teeth in their mouth, and they can't afford dentures. hearing, serious problem, vision, serious problem. There was a poll, a friend of mine in Congress told me about a poll that she did in the Midwest, in probably red country, actually. Do you know what the percentage of people in this country who support the concept of Medicare being expanded to cover dental, vision, and hearing? You know what it was? Anyone know? It's over 90%.
Yeah.
Over 90%. Nothing in America do 90% of the people agree on. On this particular one, they did agree on. And the other thing that we're working on, as Nancy mentioned, is the need to lower the Social Security retirement age. But Nancy, what is the argument we are hearing from unnamed people in Congress who say, look, Social Security is going broke, and if we want it to be there for our kids and grandchildren, look, we have to bite the bullet, right? We're going to have to make some really difficult choices. Talk about that a little bit.
There has been, again, a billionaire-funded campaign. From the very beginning, there was a small group, Social Security, Medicare, overwhelmingly popular, but there was always a small group for ideological reasons and also because they didn't want to pay the extra revenue, they didn't have to pay for it, that opposed Social Security. They lost. There used to be honest debates about these. They called it socialism, and they kept losing. So, and President Eisenhower, Republican president, who pushed for expanding Social Security, called them a tiny splinter group. In fact, he wrote a letter to his brother, which you could find online because it's now public, where he said, their number is negligent and they are stupid. He said, the people who oppose these programs. But then the late 70s, early 80s, either they all disappeared or they changed their tactic. They now say, you hear almost no one says they don't like Social Security, they don't like Medicare. They say, we love those programs, but we can't afford them. They're going bankrupt. We're going to have to cut them. Your children aren't going to be able to get them. In fact, one story that, and this is again the divide and conquer. A colleague of mine, a wonderful woman who worked for many, many years in the labor movement, was in an assisted living facility in Philadelphia, and a Republican was running for Congress and came to speak to them and said, and they asked about Social Security, and the congressman said, well, don't you worry, your benefits won't be touched. And she raised her hand and stood up and said, you have insulted everyone in this room. She said, you don't think we have children and grandchildren we care about? She got a standing ovation. He left, he lost, he never came back. But the point is that it is the divide and conquer strategy. It's again why gatherings like this are so important, because united we can win. It's solidarity. And the issues are cross-cutting. If I can deviate a little bit to tell another story that I thought it was so interesting and so useful when we were talking about housing and the impact that has on health and how all of these issues really intersect. They're interconnected. Climate change has huge issues on all of the healthcare and everything that we're talking about. There was, although I don't know that a lot of people know this, but of course, the Civil Rights Act of 1964 was enacted, which prohibited discrimination in public accommodations the year before Medicare was enacted, which was 1965. Well, hospitals are a public accommodation. So, and in the South, all the hospitals were segregated. You talk about the anger about integrating public schools. Hospitals, it's a lot of intimate bathing and details. They were dead set against it. But they wouldn't get Medicare once Medicare was enacted. They had 11 months to implement it. The federal government made sure that the hospitals were completely integrated to get Medicare, and they were.
Okay, let me jump in because I want to stay on Social Security.
Sorry.
We're talking about elderly. What is the response to folks who say, well, look, we all love Social Security, but we got to save it. The only way to save it is raise the retirement age or cut the benefits, right? What they forget to mention is that right now, if Wendell makes $16 million a year and you make $160,000 a year, you're paying exactly the same amount into the Social Security Trust Fund. So what you have been advocating for years is what we call lift the cap, right? If you lift the cap and you tax all the income of the individual, you know what we could do? At a time, by the way, when the billionaires pay an effective tax rate lower than working class people. If you do that, you can make Social Security solvent for 75 years. So you end the discussion of Social Security not being there for our kids. And the second thing you do is you raise benefits by $2,400.
A year, yeah.
All right.
And that is a bill that should be voted on.
Well, we're going to push it, believe me. All right, but it is, again, these are...
And it would put Republicans in a bind because they don't want to, they're against raising revenue, so they'd be against it for that. They definitely don't want to say they want to cut benefits because, again, their own voters against it. They don't want to offer an alternative. It is the perfect issue to bring up.
But, you know, the point of what, now I want to open it up for some questions, but the point is these terrible problems that have been discussed by so many really extraordinary people in the last couple of days that are real, and it's important we discuss it, and it's important that we not run away from them. They are solvable problems because you are living in the wealthiest country in the history of the world. So if you go out to the average American and you say, what do you think? Should we ask a small percentage of people on top to start paying their fair share of taxes so we can expand Social Security benefits, make that program solvent for 75 years? I would guess 80, 90% of the people would be for it.
There's polling that.
Yeah.
But
there is a reason why those bills don't get to the floor. And it's not just one party, by the way, I would tell you.
Yeah.
All right? And that speaks to a corrupt political system, et cetera, et cetera. All right.
But if I can...
I want to open it up to what?
I want to say
okay.
one more thing, and then
The other standard says you got to say your last thing.
Want to open it up. I mean, another really strong argument, and why it's right, it's the right policy as well as the right politics to enact the Sanders bill, is that although we are the wealthiest country in the world at the wealthiest moment in our history, it's not obviously, there's huge income and wealth inequality. And that income and wealth inequality has been estimated has cost Social Security $1.4 trillion over the last decade. That's money that stayed in the pockets of people, the wealthiest people, instead of going to Social Security. There is enough money to do all that we're talking about, but it hasn't been distributed right. And again, if there are more of us, so.
Wendell, Nancy and I have out-talked you, so you have some time to.
Well, two things. One, back to Medicare. There is enough money to add vision, dental, and hearing, and an out-of-pocket cap to Medicare. But the way the system is currently structured, the federal government is overpaying private insurance companies to the tune of about $140 billion a year, the way that these private companies have rigged the system. We can go into details, we don't have time, but they have managed to do that. If you took that money, just that money, you could do so much more to improve the Medicare program. The other point I would make is that yesterday on one of the slides about what's on the mind of young people, young voters, the economy, wage growth, or the lack of it, is at the top of the list. You look at that list, I didn't see health care. And we need to figure out how we can get young people to understand this is important. And here's why. If you have a job and you get benefits, you're not getting the raises you should be getting, because the money that could be going into your bank account, into raises, your employer is having to ship it instead to a private insurance company. That's why young people are not getting or anybody who is working is getting compensated the way they should be. But these insurance companies are taking not only our premium dollars, they're making us pay enormous amounts of money out of our own pockets. There are 100 million Americans who are in medical debt. Most of those people have health insurance. So these companies have figured out how to really screw us all and screw employers as well, too. So we've got to, and the reason we spend 17%, almost getting close to 20% of GDP on healthcare is because of the greediness and all the money that we spend wastefully. But we can improve people's lives. And when you spend that much of GDP on healthcare, that means there's not enough money to spend on housing and other things that we need to be spending money on that would improve people's lives and enable people to make a living wage.
Okay. Okay, questions, thoughts? Gigi? We got a mic? Here it comes.
In many other countries, the government actually produces medications. We have had a shortage of saline, heparin, and a number of medicines, including flu vaccines, periodically. This would be a jobs program. It could allow cheaper, costs for Medicare and others. What do you think about that?
Well, I think actually the new head of the NIH is beginning. We put a lot of pressure on these folks. And she is now beginning to talk about that. I'm going to be interviewing her on Wednesday, so we'll raise that issue. But in my view, let me detour a little bit here. I'm talking too much, but I'll just be brief. We need an entirely new model for the pharmaceutical industry. So the theory that the reason why you're paying 10 times more for a particular drug than they are in Canada, the theory is, we need that money to put into research and development so we can create these new groundbreaking drugs. Meanwhile, they're getting huge dividends and stock buybacks and everything else. And, I think often, people like Jonas Salk and these other people who developed vaccines, and Jonas Salk said, it was the thrill of his life, the achievement of his life. Of course, he didn't want any money out of it, right? So we got to create a model, and there are ways to do it, which, of course, we have to invest in research and development, and that is an expensive proposition. But the goal should be to create drugs which will save lives in America and all over the world. And if companies want to make a profit, fine. But you can't have a situation where they're making hundreds and hundreds of billions of dollars in profit when people are dying because they can't afford the product. Right now, my committee, we're in negotiations, so to speak, with Novo Nordisk. As you well know, they make Ozempic and Wegovy. These are weight loss drugs which could have a profound impact on people around our country and around the world. They're charging us 5 times more than the Canadians. I expect we're going to have Mr. Novo Nordisk before our committee to explain to us why they make tens of billions in profit and charge us the highest prices in the world when people can't afford that drug. And driving insurance costs up, of course, as well. So this is an issue we are trying to raise consciousness on. And you're touching on another issue. It is not just America. How many people died because they didn't have the vaccine, correct? Yeah. Because drug companies said, you can't afford it? Hey, you died. Really? Is that where we are in the year 2024? And that is where we are. So we need a revolution in the way we do. I respect these scientists. They're doing great work. They need to be well compensated. Companies need to make a profit if they're investing. But enough is enough. Okay, Jane?
Can you talk a little bit about the impact of private equity in hospitals? We saw it when we went around.
Jane, get the mic there.
Yeah.
Could you, Wendell, talk a little bit about the impact of private equity in hospitals?
Yeah.
We saw that as we traveled the country,
Yeah.
and it was impacting obstetrics wards, impacting hospitals.
It is, and one prominent example is just down in Massachusetts. There's this system called Steward Health. that is controlled by private equity. And it has put, I think it's 13 hospitals in jeopardy, and it's having to file for bankruptcy now. It's taken so much money out of those hospitals. And it's having to not only file for bankruptcy, it is looking to sell its physician practice to United Health, to its Optum division. So it's a problem. I will say this, though. Most physicians now are in practices owned by somebody else, private equity, certainly. But 41% of doctors are in physician practices now that are owned by hospital systems. Another over 20% is owned by insurance companies like United. United Healthcare is the largest owner and employer of doctors in the country. So you've got more than 3 out of every 5 doctors these days is now employed by or controlled by a hospital system or an insurance company. Private equity deserves intense scrutiny, but not to the exclusion of what insurance companies and hospital systems have done through their mega mergers over the years. But private equity, physician practices do need to have capital to expand, to remain independent. So the scrutiny is well placed on private equity. But certainly Congress and states and regulators need to pay attention to all of what's going on that is putting our healthcare delivery system at jeopardy and to be not only privatized but taken over by these giant corporations.
If I might, and we have a couple of doctors in the room right now. Anyone want to talk about what it means to be working for a for-profit type institution or have experience with others? Gigi, you want to say a word?
I worked for 37 years at a...
Hold the mic closer to you, ma'am.
I worked for 37 years at a for-profit institution. I'm now working for a nonprofit. I can tell you it's awful. 1 in 3 physicians over the age of 50 since COVID have dropped out and counting. It's demoralizing. It is, talk about the administrative bloat. It just keeps increasing. It's disheartening. We get treated, I think we've been stripped of our professionalism. And, the capitalist model of, everybody's a worker bee, and I'm not saying that physicians deserve anything more than nurses or other clinicians, but there's been real humiliation, I would say. And remember, restricted covenant, which is a huge issue. You can't, in DC, you can't work within 8 miles. Well, if you're in a larger state, that's not the big deal. But for people who have families, you can't.
Okay. Any other doctors want to say, or anybody else? Paul, I got a hand over there.
I'm a healthcare provider.
Okay, raise your hand. That's good up.
I'm going to try not to cry or get upset because this is really
Hold
upsetting.
the mic close to your mouth.
Yeah, it's really upsetting for me to talk about this, but I'm a clinical social worker. I work part-time at a local designated agency, the Howard Center, and I have a private practice in clinical social work. Cigna has paid the same since 2010 and refuses to give me a raise. Our designated agencies have been struggling. The amount we increased the funding doesn't keep up with inflation. And I think the greatest insult, and this is the thing that's hard to talk about, is that myself and thousands of healthcare workers are facing massive increases in premiums. I have to pay $730 a month premium with over $10,000 deductible, and then over that, 20%. And I've had COVID 5 times. The insurance companies rejected the claims, and I had to go find the rule and send it to them. And then they acted like, oops. And I said, how many people has this happened to? And they're like, we can't tell you that. Who didn't know that it's covered, that they were supposed to pay for COVID treatment. And then most recently, they told me that the doctor said I needed a $1,000 drug because I've had COVID 5 times. And there was no coverage for that, and I can't afford that. And so I think the greatest insult is that you have thousands of healthcare workers who are providing services that we can't afford, and it's not sustainable. And I'll just say this: is like, I'm at the point where I want to cancel my insurance. I want to stop accepting payment from them and just trade it. Trade, like we take care of each other, mutual aid, and insurance strike. If 50,000 healthcare workers refuse to pay insurance, what will that do to the market? But I don't want to hurt others, but I'm just saying it's...
More and more doctors and facilities are not taking not taking insurance. Cigna, that you mentioned, not giving you a raise, not covering things they should, but they announced that they, this year, will spend $11.3 billion buying back shares of their own stock. That's what's happening to this money. And when you buy back stock, it benefits no one except shareholders and a few executives. I used to benefit from myself. I know how it works. I handled financial communications for Cigna for 10 years. That's where the money's going, folks. We have a Wall Street-controlled healthcare system, a Wall Street-driven healthcare system, and when that happens, the top priority is to enhance shareholder value.
Wendell, the gentleman, and I thank you, in 2 minutes you summarized about 90% of what's wrong with the healthcare system, both as a provider and as a recipient. My guess would be, you correct me if I'm wrong here, that insurance companies thrive on the fact that people don't even know the benefits that they're entitled to.
Oh, that's right. That's right. And someone had mentioned, I think Gigi, about health literacy or the lack of it. People just don't understand it. It's enormously complex, and that benefits health insurance companies and everybody in the healthcare system. They don't understand their benefits. They don't know that, sadly, the difference between a deductible and a co-payment and a co-insurance payment. It's incredibly confusing. People, when they shop for coverage, they look at premiums and they don't pay attention to what happens on the back end. Every year, it's a term in the industry. You don't hear it publicly. They talk about it to investors. It's called benefit buy down. You pay more money every year for your premiums, but in one way or another, they're decreasing the value of that, and it takes a form of prior authorization. Increasingly, they're refusing to cover something that your doctor says you need, and that, by the way, is contributing to related to what we were saying here. Moral injury. Doctors and nurses and other caregivers are using that term to describe what it's like to work these days when you're dealing with all these constraints and all these demands, like prior authorization, you know that your patient needs something, but the insurance company is saying, no, we're not going to pay for it, or if it's delivered, refusing to pay the claim. And when you have 100 million people who have medical debt, most of those people have insurance. Most of those people the vast majority have insurance. And increasingly, people are not using their policies, Senator, because they know, even at this conference, people have told me of people that they know who have not gone to the doctor for fear of having an out-of-pocket payment that they can't afford, and they have died. That happens all the time, folks, day in and day out. People are dying, they have insurance, but they are afraid to use it. They're afraid to pick up their prescriptions. They walk away from the pharmacy counter because PBMs refuse to cover it. They make you pay hundreds, if not thousands of dollars out of your own pocket for medication.
All right, I want to get more questions. Okay. Yes, ma'am.
I'm Marcia Simon, and I'm a consultant to patient rights advocate, you mentioned Chris Deacon's presentation yesterday. I'm a former Senate staffer to two progressive Democrats, Ted Kennedy and Tom Harkin.
Great.
And what I'd like to ask is, how do we get from here to there? So how are we going to do disintermediation? Senator Sanders has a lot of really good bills. You've got medical debt, you've got Medicare for all, but you've also got a good bipartisan transparency bill that begins to shed some light on those third-party players.
It's a very important bill. Yeah, I agree with that. How do you get to disintermediation? Public policy is certainly one way. price transparency will help a lot of people. It'll help employers to understand that they do not have to overpay as they are now for what they're paying. I also spend quite a bit of time looking at what's happening in the private sector, and there are, I refer to them as enlightened agents and brokers, and there are more transparent PBMs and health plans. So we're going to be shining a light on that. It's going to take place in two areas. One is public policy at the federal and state level on transparency, on PBM reform, prior authorization reform, Medicare Advantage reform. So all that is very, very necessary. But it's important to encourage innovation that disintermediates, lessens the need for insurance companies. A lot of big employers are now contracting directly with hospitals and physician practices to ensure lower cost and actually access to higher quality care in many cases.
Okay.
And no out-of-pockets.
Other questions? Yeah.
Stephanie and Josh also back there.
Okay.
This is not really medical, but so many of the things that we've touched on this weekend, I sit as the chair of the retirement system in this town, and I also served on the retirement system for the state $5 billion fund. Everything that we've talked about this weekend has some link to private equity, whether it's your farmland loss, your water systems being bought up, your housing problem, the hospital thing. Private equity is becoming the root of all evil. So I just throw that out for your consideration.
Look, it gets back to what I believe to be true, is the people on top are doing phenomenally well, and they have huge amounts of money.
Yeah.
So they're looking for other ways. They're buying, in Vermont, they're buying childcare. They're buying housing all over the country. I mean, they have incredible money, and they want to make more money, and they're going to, not to mention that ideologically, look, the goal of the right wing in America is to, as Nancy was explaining, what did they call Social Security? Was socialism back then, or Medicare socialism, whatever it is, communism, or whatever. They do not want the people through the government to be running nonprofit institutions. They want everything to be privatized. They want water systems to be privatized, electrical power systems to be privatized. That is their goal. So right now they are on the advance. They have unlimited amounts of money. They're buying up everything and making huge amounts of money. And that is part of the oligarchic movement that we're seeing. And the only way, you got to ask what's going on, how do you change that? You got to change it through a powerful grassroots movement. We're seeing, we heard some presentations from that the trade union movement is growing, and they will help lead that effort, but that's how you're going to change that.
And
Stephanie, did you want to jump in?
I did. Is that okay? Okay. So I don't think there's a topic that I've written more about in my academic career than Social Security. I'm super fired up about this topic. In the film yesterday, there was a brief clip where you hear Alan Greenspan give a response. What you don't hear is the question he's responding to. And Alan Greenspan was, of course, chairman of the Federal Reserve at the time. He's there testifying. He's under oath. Paul Ryan poses a question, and Paul Ryan says, "Don't you agree with me, Mr. Chairman, that now is the time to begin to move to a system of personal retirement accounts? Because we all know Social Security is unsustainable, we can't afford it, it's going broke, so wouldn't a system of personal retirement accounts be the way to go?" And he repeats personal retirement accounts 5 times in a single breath, clearly leading him to the answer he's looking for, which is, yes, now would be a very good time to start to privatize Social Security. But Alan Greenspan didn't do that. He gave what I thought was a remarkable response, okay? And that's what's in the film. He leans into the microphone and Greenspan says, "I wouldn't say there's anything unsustainable with Social Security the way it's set up today. There's nothing to prevent the federal government from creating as much money as it wants and paying it to someone." All the color drained from Paul Ryan in that moment. right? Because Greenspan had just taken off the table the affordability question. No, it's not about the money. He went on to explain the money can always be there, okay? The money can always be there. Now, what I want to ask you is, we're always told that the money is running out. And the reason that you can see the money running out is because we've set it up with these dedicated earmarks in the form of these payroll tax withholdings. So the Social Security trustees put out their annual report, and every year you see the line that goes like this, which is the cash that's projected to come in, and the line that goes like this, which is the dollars that are projected to need to be paid out. And you're okay as long as the trust fund is adequate to cover those looming shortfalls. So old age survivors insurance, disability insurance, hospital insurance. The trustees tell us there are problems with all three, but not with supplemental medical insurance. What's different about that one? You got Medicare with 2 trust funds, Social Security with 2 trust funds, so you got 4 trust funds, 3 of them are in trouble, and one of them in the trustees' report, they just say, this one's fine, there's no problem. Why? Because the legislation says no matter what happens to the trust fund, the payments will always be made because they come out of quote-unquote general revenue, meaning there's no solvency issue. So the question is this. The Problem Solvers Caucus gets together. They want a Simpson-Bowles 2.0 sort of thing. They bring together a number of people to provide testimony. They invite former Congressman John Yarmouth. And Yarmouth goes in and testifies. This just happened not too long ago. And everybody's convinced that we got to solve Social Security either with cuts, means testing, whatever it is. And John Yarmouth said, why don't we just give Social Security the same authority to pay future benefits that we've already given to supplemental medical insurance? Why not just do that? And then the problem is solved, because it's not about the financing, it's about the budgetary authority that was granted to one kind of payments and not to the others. I wonder what you say to that.
Well, there's the genius of Franklin Roosevelt is that the program, absolutely you could do that. In fact, back in 1941, Roosevelt wanted to raise the FICA rate, and Congress didn't want to. It was the middle of the war, and they did put in an authorization that if Social Security couldn't meet its benefits, the general fund would make up the difference. That was repealed in 1950. So there is precedent for it, but I actually personally think it's the wrong way to go. Social Security is overwhelmingly popular. The genius of the Roosevelt administration and Frances Perkins, there are a number of women, Barbara Armstrong first, many of women are responsible for Social Security, and they understood to make the program popular and sustainable permanently over time, which is what they wanted, it had to embrace basic American values, and that's what it does. It's an earned benefit, so it's returned for hard work. A minimum wage worker pays in with the first dollar of earnings. A 16-year-old who has a summer job pays into Social Security. It unites us. We all pool and we all pay out. It's got range, divorce spousal benefits that are add-on benefits. It's got a range of things. The other thing it has, like private pension plans, which have to be segregated from the general fund. It's got a segregated trust fund with dedicated revenue. And people know that they've earned that money. In fact, I think it's the way, and again, it's your bill that's so brilliant, that it is the way to get meaningful tax reform. Because if you have progressive dedicated revenue that gets paid into Social Security, you get, otherwise it's sort of good government and they're going to always be cutting taxes. This pins them against each other. So I think the system that was set up, it was a fundamental feature of the program that was set up starting in 1935. I think, again, it's the genius of Franklin Roosevelt that he understood the American people and understood how to keep the program popular and separate from, I know we hate the deficit debates, but Social Security was protected from those debates.
It was just as a backstop.
Let me move, Josh.
So I talked to you about this, Wendell, earlier. I personally don't have health insurance right now because I have a union. I'm with the DGA, the Directors Guild. And the Directors Guild, as a union, doesn't provide health care. they work with a private healthcare insurance company that tries to kick you off your health insurance constantly and all the time, and they succeed quite often. I've never had a whole year of coverage. I get kicked off after 9 months, and then I have to go do it all over again. And so the first question is there any option for a union not to work with these rapacious, capitalist companies that are constantly trying to screw over their members? That's one. The second one is, when I did run out of insurance, I was told by the plan that I could join my plan again for the sum of $1,300 a month. Now, I said no. So I went on the Obamacare marketplace, found one that was $500 a month, signed up for that, and then went to the pharmacy to get medication. They told me my medication was $500. But without insurance, it was $120. So what the hell is going on there? And
All right,
can you
Wendell,
shed any light on
explain
why
to this
it's
young
more
man what's going
expensive
on.
with insurance? So I just said, I'm not going to sign up for insurance. I'll just pay the, you know what I mean?
I do know
the
what
whole
you
thing.
mean.
So
It's
those it's a
ridiculous.
two-part question.
Yeah, it's ridiculous. But yes, there are some alternatives, and that's why I do this disintermediation thing. The term that a lot of folks use for these big for-profit companies is BUCA. It stands for Blue Cross, United, Cigna, Humana, Aetna, Aetna and Anthem. But you don't have to work with those guys. The employers don't know there's an alternative, but there are some much more ethical and transparent. And I'll talk with you later. I think that's one of the things I want to try to help employers understand. Don't work with those big guys. They're going to take you to the cleaners, and they're going to screw your employees as well too. But yes, you're right. It's insane, Senator. You can go to the drugstore and pick up your medications cheaper by paying cash than showing your Cigna card or your Aetna card.
There's also a discount coupon right there that they tell you to scan.
Yeah.
And send it to them. Have everybody done this? It's amazing.
Yeah, yeah. They've got it, and most people don't know that. They don't know that they can do that. In fact, some pharmacists, they've been gagged and have been unable to legally tell you can get it cheaper in a different way.
In Brooklyn, they have a QR code on the counter of the Walgreens pharmacy that says, yeah, it's $300, but if you scan this code and then on your phone send it to us, it'll be $20.
Yeah.
Something like this is so crazy.
And even if they will allow you to get the drug that your doctor says you need, and often the way they construct the formularies, the drug that your doctor says you need is not on formulary. And that's because they cut deals with manufacturers to guarantee them volume. And that means, in many cases, that the more cost-effective drug that would be better for you and actually cost less is not on your formulary. It's quite the game.
With that note, let me do an advertisement for my committee. Tell you what we did to try to simplify the thing. 25 million people in America have asthma, and others have COPD. Compared to other countries, our people are paying many, many hundreds of dollars for inhalers. We negotiated with the major companies, Berlinger, Ingelheim from Germany, AstraZeneca, GlaxoSmithKline, and Teva. And as of yesterday, if you have the Berlinger Ingelheim product, the inhaler, you're going to pay $35 at the counter, as opposed to many hundreds of dollars. Simple. You go in there, that's it. You're on their computer, you pay $35. We think in a few weeks, AstraZeneca is going to implement their program. Same thing. GlaxoSmithKline needs a few more months. They will pay their thing. But what we need to do is bring simplicity to the system. The more complicated it is, more money everybody makes along the way, right? Yeah. Ellen?
Yeah, I just want to say, can you hear me? I don't have the thing.
Let's get a mic for the stream, please.
Yeah. It's really a comment, not a question, but
Powered on.
It's okay.
I'm so sorry, powered on.
Oh, is it on now?
Powered on.
Oh, sorry.
I'm so sorry.
Is it on now? You hear me? Yeah. Okay. I want to say, I think what this discussion shows, because, the left gets very splintered, and there are lots of things that divide the left, and people fight. And I think Medicare for All is one issue that can unify all of us. I know it's not happening tomorrow, but this discussion shows, because everybody in this room has a healthcare story, and those stories are about the problems with having a crazy for-profit system with these middlemen that are completely unnecessary and that raise our costs. And I just hope that we can think about this as an issue that it really brings us all together. And I know there are lots of intermediary steps, like wonderful things that come through your committee and disintermediation and all that, but Medicare for All really should be something that we can all fight for, and it's not, we can get there, is what I'm going to say. So.
Yeah,
Sarah?
let me just, obviously express agreement with Ellen and tell you another factor that we don't talk about very much. How many people do we all know who stay on their jobs that they dislike because of the decent insurance that they're getting, or they have a wife or a husband who's ill, and they stay on the job? And if you had universal health care, you could do actually the work you wanted to do, and you would get health insurance. Now, one of the political issues, which I don't want to get into now, it's a longer discussion, but when Ellen talks about the path toward Medicare for all, maybe Wendell, you want to say a word on this based on your experience. If I am an employer, right now, I just did a hearing a few days ago right here in Vermont, a family plan, I think a Blue Cross Blue Shield family plan costs about $40,000. Mm-hmm. So if I'm a small businessman, that is astronomical. How the hell do I pay my workers anything if I'm spending $40,000 on health insurance? Why are employers, in your judgment, in Canada, they don't have to worry about that, right?
Yeah.
Unions don't have to sit down and negotiate health care plans because they have health care. Why are employers, is it ideological? What is the reason why employers are saying, hey, I want my workers to have good insurance, I can't afford it, let's have a Medicare for All plan? Why are employers not jumping on board that?
Ideology is one thing. A lot of them have been led to believe that bigger government is bad, and there would be more regulations. They just have an aversion to any talk of regulation or bigger government, so you've got that. The other is that they have been lied to for so many years by insurance companies. I think that gig is going to be up before too long. But they also get tax considerations. If they do offer benefits, and I think the tax code should be changed, but they get a lot of money in tax breaks. But smaller employers increasingly are not offering benefits. They can't afford it. And so many of us work for companies that have fewer than 50 workers. And increasingly, they're throwing in the towel. They're just not able to offer benefits. And a lot of people in this room are uninsured because of various reasons, because of the cost. But employers I think they're beginning to wake up to realize that it's just an unsustainable, untenable situation.
And
Jane, let me just, Jane, how are we doing on time here? We're out of time.
Sarah,
Let Nancy say, everybody have last word.
Okay, last word, Nancy.
Okay, well, among the many advantages, just two last words, among the many advantages of Medicare for All is you don't have to worry about in-network, out-of-network, everybody's in-network, but be careful because what the other side is trying to do is Medicare Advantage for all. Yeah. You got to make sure it's traditional Medicare for all. But as a closing thought, President Obama called income and wealth inequality the defining challenge of our time. The last time we had this kind of inequality was back in the 1920s. And what did we do to end that inequality? We passed a minimum wage, maximum hours. We gave workers the power and rights to collectively bargain. We created Social Security. What should we do now? We should increase the minimum wage so it's once again a living wage. We should strengthen workers' ability to collectively bargain, and we should expand Social Security and Medicare.
Good.
I would say that one of the things that we need to understand is that the system we have now With these big companies becoming bigger and bigger, United Healthcare is now I think it's the fourth largest company in this country. When I started working in the industry, few people even heard of United. CVS Aetna is right behind it. Cigna is up to number 13, far bigger than any other healthcare company, but bigger than GE, bigger than GM, bigger than companies you've heard of forever. These companies are massive. Because as they've gotten bigger, we have seen this enormous transfer of wealth from regular folks to shareholders of these big companies and to the executives of these big companies. So just know that. And you may be young, you may not. Young people think they're invincible. I remember I did too, bulletproof. But if you think about the economy and the economic problems that you face, see them as a bad guy because they are standing in the way of your getting a raise, getting the health care you need, and your parents and everybody you know too. So it is an enormous transfer of wealth from middle-class folks to billionaires.
Let me conclude by just picking up on Ellen's point, and that is despite the massive propaganda efforts on the part of the insurance companies and the drug companies, at the end of the day, you know what? You go to the average American, you say, do you think healthcare is a human right that should be guaranteed to every man, woman, and child in our country, regardless of income, regardless of where they live, regardless of how old they are? People say yes. Do you think we should join every other major country on earth in moving forward in that principle? People say yes. So it is, and the last point that I want to make, it's not only, it goes even deeper than your ability to go to the doctor and not worry about the cost. It really talks to how you live in a society. If I'm going to make money off of you, you're going to a doctor, a very basic need, and you're walking in there, oh God, I can't afford it, what are they going to, as opposed to saying, hey, I'm an American. Yeah. And like everybody else in our country, of course I'm entitled to health care. And thank you, doctor, for your hard work, and you're doing your job well, and the hospitals are doing their job well, and we're all the goal is to improve our health. Think about the psyche impact of that as opposed to a system where doctors are working for large corporations, you're not seeing enough patients, cut your time down, you can't afford to go to the doctor, you have to stay on your job because you have decent insurance. So it's more than just healthcare. It is creating a society where people are able to care for each other rather than see a few make huge profits. On that note, thank you all very much.
Thank you so much, Senator.